Yeah, so thanks everyone for the invitation to come present to you today. Um, I on this emerging and this changing issue, this issue that's been adapting in the U.S. For quite some time now. I wanted to make this presentation a bit more interactive, but unfortunately, HPAI is a rather sobering topic, and there's still so much that we don't know about this disease, about its effects, and what it's capable of doing and what it will do in the future. So unfortunately, this presentation may actually lead to more questions than answers, but at least we can discuss a few things, a few findings, a few initiatives that we've undertaken, and bring everyone up to speed on this new recent threat from an influenza virus, sort of our old foe of influenza. And so with that, before I begin, I'd like to share my own land acknowledgement. I wanted to acknowledge that the land that I work and play on is the traditional unceded territory of the Maliseet here in New Brunswick. And this territory is covered by the treaties of peace and friendship. And so quick outline of what we're going to be discussing today. We'll get the boring stuff out of the way first. So we'll do a bit of epidemiology 101. And then I want everyone to understand sort of what is CAHSS. CAHSS is a relatively new concept working within Animal Health Canada. And so I want everyone to understand what CAHSS is, what we do at CAHSS, what role we fill. And then we'll be able to see sort of how that panned out with the new threat of avian influenza in dairy cattle in the US, which is how we will finish off our discussion talking about that new threat. And then, as Tina said, we'll open it up for some questions and some discussion. So we'll get the boring stuff out of the way first, just a few basic terminology. Epidemiology is obviously the area that I work in and the area that those of us at CAHSS work in. We're veterinary epidemiologists. So epidemiology is the study of how diseases move through different groups of people, animals, through different populations, and why, sort of a measure of risk factors and contributors to how that disease acts in populations. Stakeholders are persons and organizations who contribute to, use, and benefit from surveillance. And so within CAHSS, we have a lot of stakeholders. One Health is an integrated, unifying approach to balance and optimize the health of people, animals, and the environment. And so the One Health concept is something that I want everyone in attendance today to keep in the back of your minds. We're going to be approaching our discussions around highly pathogenic avian influenza from a One Health perspective. What has been the effect on the animals? What has been the effect on people and human systems? And what has been the effect on the environment or potential effects on the environment that we may see? And then ultimately, what we do in CAHSS is disease surveillance, which is an information-based activity involving the collection, analysis, interpretation, and sharing of large volumes of data originating from a large variety of sources. So now the terminology is done. We'll go into the first part of the presentation, which is what is CAHSS exactly. So what is CAHSS, the Canadian Animal Health Surveillance System, which I'll just refer to as CAHSS from here on out. So the CAHSS is a distinct division of an entity called Animal Health Canada, and we're one of three distinct divisions. So Animal Health Canada is a group within Canada that has the vision of advancing animal health and welfare through a sustainable agriculture and agri-food partnership, including industry and government collaboration. And so that is the goal and the mission of Animal Health Canada. Three distinct divisions within Animal Health Canada. We have the National Farm Animal Care Council. They are responsible for addressing animal welfare, generating codes of practice within Canada. And we have emergency management, which is responsible for responding to and addressing emerging issues, any sort of emergency that may arise within Canada's agricultural sectors. So that could be disease outbreaks, environmental disasters, whatever comes our way. And CAHSS is a Canadian Animal Health Surveillance System. Our role is to gather information and filter that information back into these two divisions to help them do their work. As well as undertake a few activities ourselves, drive some surveillance initiatives, and work within our networks on disease surveillance, primarily for animals and animal agriculture. So the mission of CAHSS is to bring together and use data-driven information to demonstrate animal health, minimize impacts of disease, and guide planning on national animal health priorities. And this was really put to the test with the emergence of highly pathogenic avian influenza in dairy cows in the United States. We want to minimize the impacts that that disease will have on our sectors. We want to guide planning on how we're going to address highly pathogenic avian influenza. And then we want to demonstrate either freedom from disease or levels of disease-induced surveillance around highly pathogenic avian influenza within our own country here in Canada. So how CAHSS works is through a network of networks. So our surveillance networks are the primary founders of the Canadian Animal Health Surveillance System. We have 7 species-specific networks, which you can see on your screen. There's beef, dairy, equine, companion animal, aquaculture, poultry, small ruminant, and then we have 2 separate working groups on vector-borne diseases and antimicrobial use and resistance. And so obviously these are large sectors, and these are 2 emerging, highly relevant One Health issues that we are faced with. And so each network is a little bit different, but usually includes representation from animal, agriculture, agri-food industry, organizations, veterinary sector, federal, provincial, territorial government, laboratories, universities, academia, and they all participate in the sharing of information, which we do, and the gathering of information that we do within CAHSS through the network of networks. And just to give everyone a better idea of how that works within CAHSS, on your screen, you should see an example of our dairy surveillance network. So obviously the one that is the most relevant to highly pathogenic avian influenza. And you can see there's a lot of different nodes. Each different node would represent one area of the network, and all the smaller nodes would represent various different stakeholders that are involved in the network. And so the role of CAHSS is ultimately to share and funnel information through all of these networks, all of these stakeholders within the network, to make sure that this node over here is aware of what's going on with this node over here. And if this node here undertakes an activity, a surveillance activity, or an initiative, that these nodes here are aware of that as well and are able to reduce redundancy, make sure they're not doing the same thing that the other nodes are doing, and also benefit from the information, the resources that may be generated from that node as well. So within each node, within each species surveillance network, all of these nodes feed information up into the larger sectors, which all get shared within CAHSS, and then we would share that information back out so that every stakeholder involved in every one of these nodes knows what's going on within the dairy surveillance industry. The dairy surveillance sector knows what's going on and can plan their own activities accordingly. And so I would invite everyone on this call to find the networks that are right for you. Members within CAHSS include One Health researchers, government staff, both federal, provincial, and territorial, industry, diagnostic lab staff, academia, surveillance partners, private practitioners and technicians, producers, students, essentially anybody working in the One Health space. So if it's climate, if it's human health, if it's animal health, you're all welcome to join our networks. You can join as many or one of the networks that you want that's most relevant to what you're doing. And you can participate in that sharing of information, receiving information, and participate in national surveillance, which runs through that network of networks. So bit of an invitation, bit of call to action. The website's very simple, CAHSS.ca. You can access it there and find the network that's most relevant to you. And so finally, just to end off on sort of animal health surveillance before we dive into highly pathogenic avian influenza, the classic Swiss cheese model of surveillance. And so the point of this slide is for animal health surveillance to be robust. It has to be very resistant and very robust to respond to issues. And so what we see here, the classic Swiss cheese model is that there's a lot of holes in each layer of surveillance and each layer of the Swiss cheese. And what happens when the holes line up is things can get through, risk factors can get through, diseases can get through. And so we want to make sure that all the areas of our surveillance and our response plan at least one of those is going to cover up the hole so that the risk doesn't get through, and ultimately, result in a One Health success story to protect human health, environmental health, and animal health. And so we have multiple different sectors that work in various areas of surveillance, horizon scanning, observing and telling, counting of cases, monitoring for signals, and active testing. And so if I was going to use highly pathogenic avian influenza as an example of this Swiss cheese model of surveillance, first of all, horizon scanning was never going to be able to detect and pick that up. So horizon scanning, just scanning for what's out there, picking up on signals, determining what risks may be there, and then using that information to generate a response. Highly pathogenic avian influenza was so novel and so new and so unexpected in dairy cattle, right? It's avian influenza. We don't expect that to hit dairy cattle. Dairy cattle and cattle in general were thought to be resistant to influenza infections in particular. We've never really had to deal with influenza as an issue in cattle, for the longest time. And so it wasn't really on anybody's radar. And so horizon scanning wasn't going to pick that up. Where we learned about this was through field veterinarians observing and telling. So field veterinarians identified something wrong. They knew something was not quite right with the cows. They knew something was not lining up as far as typical diseases that they would observe in cattle and how they would respond to those. And so they observed that. They told that on to the respective people in the U.S. And they got this diagnosed, defined, and now the outbreak's being dealt with. USDA is now counting cases. So the United States Department of Agriculture is currently counting the cases and doing surveillance in their own country. Here in Canada, we're monitoring for signals to see if we can detect it while we were putting together a plan for active testing. Active surveillance obviously is the gold standard for surveillance. It would be great if we could do active surveillance for everything, but unfortunately, it's usually very costly and needs to be quite targeted. But Canada is now in the active surveillance phase for highly pathogenic avian influenza, run through the Canadian Food Inspection Agency, where we are testing samples to see if we can detect it. And so within CAHSS, again, we take all the activities being done here by all the different stakeholders who are working in these spaces. We synthesize, we compile that information, and then we send it back out to all the relevant stakeholders who have an interest, a vested interest in highly pathogenic avian influenza. So ultimately, with data synthesizers, data integrators, and knowledge transfer and translation piece is where you get the role of CAHSS to fit in all of this. So we don't do a lot of these active surveillance, active testing things, but we share that information across the network of networks, which you just saw, to make sure everyone is on the same page as far as information goes, to address any rise in misinformation, and to make sure that we're all working collectively towards the same goal, which has worked very well for us here in Canada because to date, we have not detected a highly pathogenic avian influenza in our dairy herd in Canada, despite it spreading quite rapidly and consistently across the U.S. As of today, we do not have it in our dairy cattle in Canada. So that's been pretty successful. A good little story of collaboration and response and preparedness. So now we're going to switch gears and actually talk about highly pathogenic avian influenza. Should be the more interesting part, and how climate and agriculture adapting to the One Health challenges presented by highly pathogenic avian influenza will shape sort of how we move forward with agriculture, with disease management, and with ultimately pandemic prevention. And so I had asked that One Health be sort of in the back of everyone's mind as we're having this discussion. What I also want is everyone to think about the integratedness of climate change and agriculture. So agricultural production, as we all know, is highly dependent on weather and climate, right? We need good weather, we need a good climate to make food. If one is not very good, then the other doesn't pan out very good as well. The opposite is also true, as we all know. Weather and climate are influenced by agricultural practices. Intensive agricultural practices do have effects on the land. effects on water usage as we are generating food for that. And the health of our populations, both human and animals, is highly dependent on our ability to make food. Making food is very, very important. And humanity needs to produce enough food, fiber, and feed to meet the needs of nearly 10 billion people, the projected human population of the Earth, by 2050. And we're going to need to do this on essentially less working land than we have right now, which we're currently using to feed 8 billion people. So we need to feed 2 additional billion people with less land, that was going to be available to do that. This requires boosting yields while minimizing unintended environmental impacts and also dealing with the impacts of increasing urban sprawl. So the spreading of cities, the spreading of population centers takes away land that we would want to use to grow that food. It'd be easier to grow the food if we had indefinite amounts of land. And so certain practices work well that we currently use, but they also leave agricultural vulnerable. And so you can look at the picture on the screen if you were thinking about grazing animals and where I was going to graze these animals. It's pretty clear that you're going to want to graze those animals on the green grass, where things are able to be eaten and consumed and turned into food. And you're not going to want to graze them on sort of the barren, dry land. That's not going to be very useful for making food. And so these are obviously they shift with the changing seasons, particularly in the US. And so practices that we may have to help maximize our ability to generate food are also going to affect diseases and the spread of diseases. So I want everyone just to sort of keep sort of climate in the back of their mind, environmental impacts in the back of their mind, and the vulnerability that we see as we shift our food production systems to more intensive, higher production systems in order to meet the requirements of feeding an additional 2 billion people. So on March 15th, 2024, March 15th of this year, the story hit the media that there were concerns developing as a lot of cows fell ill in Texas. This was referred to as the mystery Texas disease. At that time, nobody had any idea what was going on. They just knew that these cows were not exhibiting normal symptoms that we expect to see in sick cows, and that something was off. This was also going on at the same time as the fires were going on in the Texas Panhandle. So we weren't sure if those were related, if the fires were driving something into the cattle or exposing them to another species. Nobody really knew. But that was the same time as the Texas Panhandle fires were going on. And then very shortly after that, March 20th, 2024, avian flu was detected for the first time in U.S. livestock, and this was the goats that they detected in Minnesota. So this detection got people a little worried. Avian influenza can infect ruminants now, as demonstrated by the goats. Could these sick cows, this mystery disease in Texas, be avian influenza? There was also some dead birds associated with those sick cows at that time, and so it did seem to be highly suspicious that it was a novel disease and that it could be related to avian influenza. And then unfortunately, on March 25th, 2024, the USDA, the Federal Drug Administration, and the Center for Disease Control in the US announced that highly pathogenic avian influenza H5N1 had been identified in US dairy cattle for the first time. They identified this as the Eurasian lineage goose Guangdong clade 2.3.4.4b. That's the same strain that's been causing issues in the poultry sector since 2022, since the first outbreaks in 2022. And this unique strain in the dairy side was B3.13. So B3.13 is a specific strain to dairy, but 2.3.4.4b is what's affecting the poultry. That may or may not be strain B3.13. In response to that, Canada, we had to tighten import requirements. We didn't want to have cattle coming in that had highly pathogenic avian influenza. So that all happened relatively quickly. And this was, since this date and since this event, we've learned that was most likely a single spillover event. So we don't have any idea how that exactly happened. Nobody really knows. Somehow it happened in Texas. That the H5N1 from a wild bird managed to find its way into a cow and is now spread all across the U.S. Adapted to those cows and has done pretty good job spreading from cow to cow. That single spillover event, as said, nobody knows whether it was cows that were sharing a watering hole with waterfowl. Could be very likely. Whether a dead bird somehow got into the cow feed or got into a feed mixer and got ground up and fed to the cows. Nobody really knows. But the point is, this was a very unexpected, unprecedented disease event, and nobody really knew how to respond to this. They didn't know how it was going to go or how it was going to play out because we weren't expecting avian influenza to hit cattle. Since that date, the map on your screen is the current U.S. situation. So the U.S. has now identified 404 herd outbreaks in 14 different states. You can see all the blue states have been states that have identified at least one dairy herd as being positive, and the darker blue ones have identified much more dairy herds than that. I will say that this is very much likely an underrepresentation of the true number of the herds that have highly pathogenic avian influenza in their dairy herd in the U.S. And it's probably an underrepresentation of the number of states as well. The USDA has only just formalized a national surveillance scheme to actually find the true prevalence of this. A lot of these herds were relying on voluntary reporting, voluntary surveillance, and there was not a lot of uptake of voluntary reporting and voluntary surveillance in the U.S. dairy industry. So they have confirmed 404 total herds. It is most likely higher. And as stated, it started in Texas. And when we talk about agricultural practices and how we want to optimize land use and resources that we have for maximum efficiency and maximum production, one very common practice in the U.S. Is to graze your cattle in the southern U.S. during the early seasons when it's warm and things are still growing in the south. You then move those cattle up north for the summer months in the northern part of the country to capitalize on grazing and growth in the north, and then you move those cows back down to the south as winter starts to hit the north, but things remain sort of warm and continue to grow down in the south. And so that practice, the north-south movement of animals, very likely contributed to the spread of this disease. We know that cattle-to-cattle movement of affected cows into unaffected states is the primary driver of the spread of this disease into state. And that practice of sending your animals where they're going to have the most efficient grazing options available to them is a good practice, again, as far as efficiency goes, but it's not a great practice when it comes to biosecurity and limiting disease spread. It's also unclear right now how it's being spread from farm to farm in close proximity. So we know it enters the state through the movement of cattle, but once it enters that state, it spreads through the dairy herds very rapidly. And we know there's not movement of dairy cows to all of those herds within close proximity, but the virus spreads to them very easily and very readily. And so we don't know what the primary driver is of that move, the infection rate between herds that are in very close proximity. There's been a lot of ideas put forward. Could human beings be spreading it? Humans that often interact with other farms, farms in close vicinity or their neighboring farms. Could other vectors be involved? So vehicles, people who visit farms on a daily basis, so veterinarians, dairy advisors, nutritionists. There's a lot of common exposure to a lot of dairy farms. And then, could it be driven by other animals, birds, mice, cats? They're all capable of carrying this virus and spreading it around. So that between farm movement, we don't really know the primary driver of that. All we know is that moving cows into states will bring it into the state. And once it's in a state, it will spread very rapidly and very quickly. The impacts of highly pathogenic avian influenza aren't just on animal health, and they're not just in the dairy sector. So these disease events, a disease outbreak in a herd, in your herd or in your friend's herd or your colleague's herd, those are very stressful times. They're very stressful for the producer. They're very stressful for the veterinarians. And both of these sectors right now are very underserved and understaffed. There's a veterinary shortage across North America and globally. There's also a shortage of people, who are working in agriculture and working in food production. So they're already working very hard, already stressed out, and then you throw a major disease outbreak on top of that, and it becomes very stressful for these individuals. Also, these animals need treatment. And treatment of animals very often involves antibiotics. In cattle, we deal with a lot of bacterial diseases. And so a rapid increase in the number of sick animals is going to lead to an increase in the number of antibiotics, the amount of antibiotics being used, which is going to increase antimicrobial use pressures, resistance pressures, and will ultimately drive sort of development of antimicrobial resistance, which is a major global health concern at the moment. So we're trying to limit our use of antimicrobials, but when you have massive disease outbreaks, you're sort of restricted to having to actually treat a lot more animals than you wanted to. They need to be treated, and so higher levels of antimicrobials are probably going into these animals, which is affecting sort of the One Health principles of antimicrobial use and resistance. And also, even though dairy is the hot topic right now, we can't forget that this is primarily a poultry industry disease. And so this map, when compared to the dairy map, this is a map of the states that have reported poultry outbreaks. And ultimately, as you can see, every state has had a poultry outbreak, with some states like Iowa reporting outbreaks in 23 million birds. And so the poultry situation since 2022 with highly pathogenic avian influenza has been huge. It's been devastating. It's been very, very impactful. And again, driven by a lot of the agricultural practices that we've needed to employ to become more sustainable, to generate more food, to continue to feed more people. Particularly in the US, large herds, large dairy herds, large poultry flocks, they're very efficient, they're very cheap to produce animal resources, but they're also very highly vulnerable to disease outbreaks. So just like large living centers for people become virus hotspots, we saw that with COVID. Large herds and large flocks also become virus hotspots, and outbreaks in these flocks and in these herds become absolutely devastating, to the state, to the producers, to the economics of the state, the economics of the industry, and to the environment that this thing occurs in. So the current outbreak in poultry is 3.64 million birds. That's just in the last 30 days. 3.6 million birds have been identified. And since 2022, the total outbreak has gone above and beyond 100 million birds. So there's been 100 million birds identified with highly pathogenic avian influenza and subsequently destroyed since 2022. Over 18 million birds have been detected and destroyed specifically due to the B3.13 strain. So these were poultry operations that were in close proximity to an affected dairy. The virus spread back from the dairy into the poultry, and then the poultry operation has to be depopulated. So 3.6 million birds currently affected, over 100 million birds destroyed since 2022. And since March of 2024, 18 million birds had to be destroyed due to the dairy-specific strain of B3.13. And currently, although we were lucky and haven't had any dairy outbreaks in Canada, there's now multiple outbreaks of avian influenza being reported in Canada, primarily in British Columbia and Saskatchewan. Luckily, again, in Canada, our population densities tend to be significantly lower and much smaller than what we see in the US. We don't have the same large poultry flocks We don't have the, the 1.8 million, bird operations. We don't have dairy farms with 10,000 cows in Canada. So the impact is much less than what they see in the US, but it's still relatively large and impactful when it does hit. Avian poultry farmers in British Columbia and Saskatchewan currently dealing with outbreaks, in their provinces, massive outbreak in the US. And just to put some numbers behind this, so again, try to bring everything back to, what's the effect on economics? What's the effect on the environment? What's the ultimate effect to one health? The average chicken produces 1.7 kilograms of edible meat. And so if those were all chickens, which they weren't, because there's a lot of turkeys involved too, which are larger and make more meat. But just assuming if they were all chicken, 1.7 kilograms of edible meat multiplied by 100 million birds is 170 million plus kilograms of food, edible food for human consumption. That has been lost due to this outbreak in 2 years. So that's a lot of food. And it's not just, the loss of the chicken and the loss of the meat, but it's all the resources that we put into growing those birds, to raising those birds for the local markets. And so that's all lost when we depopulate these birds. And on top of that, we have to dispose of the carcasses through the depopulation. So we've had to dispose of 100 million, chicken carcasses, poultry carcasses, mostly through incineration, which takes, resources and energy as well. And we've also had to dispose of more dairy carcasses, more carcasses of some sick or dead cows than typically we would in the dairy industry in the US. And so those are large animals as well. So a lot of resources go into, raising these animals. Losing them is not great. And then we have to put a lot of resources into the depopulation and the disposal of the carcasses as well. And what effects that will ultimately have on sort of environmental health remains to be seen. It'll take quite a while actually to probably figure that out, but I imagine it will be relatively significant. And just to bring it full circle, I guess, so that's the dairy issue and the poultry issue. Highly pathogenic avian influenza, though, it doesn't discriminate. It's a very diverse virus, and it can pretty much affect any species. It's really kind of remarkable if you think about an organism that is capable of doing what highly pathogenic avian influenza is capable of doing, and sort of what species it's able to colonize and adapt to and spread in. And so this is all the other non-ruminant, non-poultry detections in the US. And you can just see by the list on the right, there's a large number of species that avian influenza has no trouble adapting to. We've got cats, big cats, bobcats. Domestic cats have been relatively significant in this outbreak because domestic cats are an integral part of most dairy operations. Most dairy farms have a relative, colony of domestic cats that also live on the farm. The cats provide shelter, or the cats usually provide some rodent control, and the farm provides shelter. There's usually a source of food, warmth for cats that have to overwinter. Is a lot of domestic cats on dairy farms, essentially. And highly pathogenic avian influenza, had no trouble affecting those cats, and it's been devastating to those cats. So they've been well involved, well implicated in the disease. After dairy cattle and poultry, cats would probably be the next most significant species. We got lions, bears, dolphins, gray seals. Probably everybody heard about the mass gray seal die-off that was attributed to highly pathogenic avian influenza as well. Coyotes, foxes, martens, mink, otters, raccoons, skunks, possums, squirrels, voles, mice, you name it. And unfortunately, just yesterday, the USDA reported their first case in a pig. And so we're relatively concerned about reports in pigs because pigs become amplifying vessels for influenza viruses. They're susceptible to human strains, they're susceptible to poultry strains, and they typically have circulating swine flu strains as well. Luckily, this pig was a backyard pig and was not a commercial pig, so the risk is low, but now it can get into pigs too. And so that generates a bit of concern as far as pandemic potential, reassortment potential, and what this virus will ultimately do in the future. But the point of this slide again is that highly pathogenic avian influenza doesn't discriminate. It will affect just about anything. And the one thing that wasn't on this slide but is on this slide is that it will also affect people, and has been ramping up the number of human cases ever since the dairy outbreak sort of started. So back to our timeline, on April 1st, the CDC confirmed one human H5N1 infection in a person with exposure to dairy cows. That first one was in Texas, and this was thought to be the first instance of mammal to human spread of highly pathogenic avian influenza. And the CDC has since been reporting, and you can see the states where the major outbreaks are the states where most of the people are getting affected. So they've identified 39 total people that have been affected with highly pathogenic avian influenza. The cattle one, quite a few, 20 have been affected with the cattle strain, the B313, another 18 with poultry, and almost all of these ones, with the exception of Missouri, have been farm workers or those people who've been exposed to farm animals, either dairy or poultry, or the depopulation activities that undergo. And so the number may seem low. Again, it's probably an underreporting. There's probably a lot more that just haven't been identified. But every time this virus affects a person, it has a chance of coming in contact with a human strain of influenza and reassorting. And so every time it does that, we're essentially rolling the dice on a possible flu pandemic, which is why the CDC is monitoring this and making some recommendations around flu prevention, which we'll get into in a minute. So I thought just to do a little bit of interaction, I wanted to just have the group sort of shout out in the chat. I'll call out a species and what the primary outcome of that species is. I haven't talked about symptoms yet, so we're going to do that this way. So on the left, you'll see the species, and on the right, you will see the primary outcome, essentially. And so I want the group to shout out. I should be able to see that on the chat on my right, what the primary symptom is. And so we'll start with poultry. I see somebody nailed the cows already. We'll start with poultry, so chickens and turkeys. What is the primary symptom there? Death, 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 death. Yeah, very good. Death. All right, dairy cows. Yeah, very good group. People have been paying attention to the news. Yeah, dairy cows, primarily mastitis, loss of production. How about domestic cats? Yeah, that's a lot more diverse than the animals. So the primary outcome with domestic cats has been death. But as a lot of people mention, this is usually as a result of a neurologic disease. But most of these cats are being found dead. So you can say one or the other. Ultimately, I think the primary outcome for those cats is death. What about humans? Very, very good. Yeah, conjunctivitis. And then how about, last but not least, the waterfowl? Nothing. Good group. Everyone's really smart. Yeah, no symptoms. So I think if you look at this slide here, it's just wild to me how, what HPAI can do, what influenza can do. We've got conjunctivitis in people, which may seem relatively, benign. All these humans tend to recover with antivirals and some rest. They don't even need to be hospitalized. We have very sick dairy cows with mastitis, and we have cats and chickens and turkeys dying en masse. And so very diverse, again, very diverse virus, lots of species, lots of different symptoms. Nobody knows what it's going to do in the next species that it decides to infect. So very good. Thank you for the little bit of interaction. So I'm going to end off with what have we done in Canada? We really wanted to avoid some of the issues that they're dealing with in the US, some of the distrust that they've had between federal and state authorities, this really, weary or sort of distrust of large corporate interests, using economics and finances to drive decisions on public health. And so in Canada, we've taken a collaborative multi-stakeholder approach. So we have contribution from federal, provincial, territorial, and industry partners. All of our stakeholders are involved in this. And so activities that the various stakeholders have done. We've done a risk assessment for Canada. So this was done by the Centre for Zoonotic and Emerging Diseases. They generated a risk assessment. What was the risk to Canada? That risk came out to be a high risk, or we are at high risk of getting HPAI in our dairy cows. So our risk assessment was done by CZ. Within CAHSS, we've done education, surveillance, and data synthesis to pass on the information to and from our stakeholders on HPAI, not just in dairy cattle, but in poultry, swine, small ruminant, and every other species of consideration for this disease. We've been managing that within CAHSS. Animal Health Canada and Dairy Farmers of Canada collaborated to generate enhanced biosecurity documents for dairy producers and for fairs and shows. One of the higher risk areas is the show cattle that we identified. So we generated those biosecurity documents with the Animal Health Canada and Dairy Farmers of Canada. CFIA conducted retail milk sampling. That was the early initial surveillance. That was the easiest one to do. Take milk products from the shelves in the grocery stores and test them for HPAI. They all came back negative. CFIA, in collaboration with the Dairy Processors Association of Canada, have been working on processor level surveillance. So they're testing the raw milk at the processor level, and that's all been negative. And CFIA, in collaboration with the Veterinary Surveillance and Epidemiology Network and Dairy Farmers of Canada, have been working on farm level bulk tank surveillance. So those details are still being worked out. It's a lot of nuances there, but we're working on that. We're actually ahead of the US on our bulk tank surveillance scheme. And then CFIA, in collaboration with the Chief Council of Veterinary Officers, have worked out our response. What are we going to do if we detect it in Canada? So that's been generated and ready to go. And then the Public Health Agency of Canada has worked on public health guidance for the general public. This slide here, very interesting slide. So what sort of works against those responses? So these responses in Canada have been very successful to date, and they continue to work well for us. What works against those is misinformation, sensational media, capitalists, the forces of capitalism, and general public distrust in federal officials, official responders. And so, within CAHSS, we work in the surveillance area. And so surveillance really helps us address misinformation because we get a sense of what is really going on, what is actually going on. We share honest and open information, and that allows us to react and respond quickly and communicate. And so I really like this report from Policy Horizons Canada, Disruptions on the Horizon. If you haven't read it, I would encourage everyone to read it. It's very interesting in sort of what disruptions we can expect in Canada and which ones will be most impactful. Something like World War, obviously very impactful, but not very likely. But number one, you see on both lists, the most likely disruption is people cannot tell what is true and what is not, misinformation. And that's also on the highest impact disruptions list as well. So with surveillance, we can help address misinformation. And we can address sort of sensational news articles that throw public officials and those working in the space in sort of a negative light. It's something they're really struggling with in the US. They will probably continue to struggle in it. It has really impacted their ability to respond appropriately to this disease outbreak. And it's something we want to avoid here in Canada. So finally, what can everyone on this call do to prevent the spread of avian influenza? This little graphic put out by the Public Health Agency of Canada, I think, is very nice. It's very simple and sums it up pretty nicely. So if you're out in nature, keep your distance from wild birds. Don't touch, hand feed, or handle them. Don't go up and interact with dead birds as well, or even dead animals. If you do see dead birds or dead, rodents, dead wild species, you're highly encouraged to contact the Canadian Wildlife Health Cooperative. That's an area that we can do surveillance in. We can test those dead birds if we can get them submitted properly, and they will instruct you on proper handling of those birds or what you should do, or they may send someone out to collect it, or have you call DNR or something. But otherwise, if you just see them, don't interact with them. If you're outside with your pet, keep your pet away from sick or dead birds, and always contact your veterinarian if your pet gets sick. Wash your hands is generally a good recommendation for everything. And when you're preparing food, cook all meat, and consume pasteurized milk, which is standard in Canada anyway to consume pasteurized milk. There's major concerns in the US about the sale of pasteurized milk and the spread of highly pathogenic avian influenza through the consumption of raw milk, because it is in the milk in very high volumes. And then, of course, plan to get your flu shot. Again, generally a good recommendation to make. The flu vaccine doesn't protect against H5N1, but it will reduce the risk of a human being infected with both seasonal flu and the bird flu, and reduce the risk of reassortment. So particularly if you're working in the animal health sector, or working in close proximity to cattle and poultry, plan to get your flu shot. And just to bring everything back again, it's not just North America, and it's not just highly pathogenic avian influenza. So there's a lot of signals, there's a lot of things going on in the world. Monkeypox is spreading across Africa. Swine fever, swept through the northern Italy. They lost 100,000 pigs, I think. And now it's going to put some stress on the prosciutto market. So if you like prosciutto, it might be very difficult to get prosciutto. It's just a really good example of how a disease event can impact a lot of the things that we may take for granted. Ticks, vectors spreading, the Asian longhorn tick spreading up is relatively concerning. And blue tongue virus is also spreading across Europe and devastating sheep and cattle. So we have highly pathogenic avian influenza in North America. They have blue tongue virus in Europe. And this is one thing, again, in Europe, they have, these are smaller backyard sheep farms, typically smaller cattle farms. Doesn't really matter. A disease will find a way and adapt to those systems and will spread through it. So HPAI spreads really good in high confinement, high population systems. But blue tongue virus it's spread through midges, and so it spreads very well in smaller farms that are outside and exposed to insects. So there's no real way to escape it. And tuberculosis, returned as the top infectious disease killer. Just last year, it surpassed COVID again to be the #1 disease killer of human beings. And so our old nemesis, tuberculosis, is also rearing its head. I just want to acknowledge funding for CAHSS. Their funding is provided through the Agri Assurance Program under the Sustainable Canadian Agricultural Partnership, which is a federal, provincial, territorial initiative. So we thank our funders, who, sustainable funding is what enables CAHSS to do the work that it's able to do. And with that, I will turn it over to the Q&A section and try to get through your questions.